We are going to move on to the next presenter, Dr. Louis Bell, who is the Director for Family Services in the Ministry of Health and also the assignee to the National Advisory Board for Persons with Disability from the Ministry of Health. And we want to invite Dr. Louis Bell to make her presentation.
As it relates to health, like any other sector, what this means is that there must be prevention of discrimination and reasonable accommodation for all. In terms of health, the minister responsible for health should provide and ensure that healthcare providers and facilities adhere to certain standards and provide access to general healthcare services and facilities for persons with disabilities. And this means that the highest standard of healthcare must be provided to all without discrimination on the basis of a disability. Now, in terms of the provision of services to persons with a disability, this will necessarily include the screening, early detection, treatment, rehabilitation, identification, and intervention as appropriate, and services designed to prevent or minimize any further disability. The Ministry of Health has a vision of healthy people, healthy environment, and our mission is to ensure the provision of quality health services to promote healthy lifestyles and environmental practices for all persons. Now, the Ministry of Health doesn't have a specific health policy related to the care of persons with disabilities, but we do have a policy of inclusion, providing services to all persons free of cost, irrespective of their status and their abilities. Healthcare workers are taught in their respective schools to manage persons holistically, and as such, our physicians in both our primary and secondary care facilities and our nurses have been accustomed to providing care to the best of their abilities for persons with disabilities. And we have a network of some 24 hospitals and over 320 health centers throughout the island in the public sector that provides care free of cost to all persons. Recognizing that we have to prioritize certain groups, including the disabled as well as children and the elderly, the government of Jamaica and the United Nations Population Fund, through a grant from the European Development Fund, implemented a project specifically related to sexual and reproductive health, which targeted persons with disabilities, among others. As such, the focus was on the provision of services including information, communication, and education for all persons with disabilities, including persons who are deaf. And so educational material in large print, braille, and interactive electronic games were developed. A special reproductive health window was also established at the Jamaica Council for Persons with Disabilities, and a mobile unit was also secured. And sensitization and training material was also prepared with the assistance of persons working in the disabled sector for healthcare workers, so as to sensitize the healthcare workers as to the special needs of the disabled. And we also recognized that we had to do an audit of our health facilities. And so in September 2008, a special audit of our facilities were done to ensure that we had access for persons with disabilities, and where necessary, we would have to put provisions in place where they were not in place, such as ramps and signage. Now, in our health services, the visual and hearing impaired are usually asked to bring a friend or a relative with them to the health facilities to facilitate communication, and where appropriate, communication is done through writing. We have also developed certain guidelines and a checklist to monitor the use of those guidelines for ensuring access to our facilities, and a number of international codes as well as local building code were used to develop these guidelines and the checklist. And the guidelines were done to ensure that we standardized our health facilities in terms of access for persons with disabilities and to ensure adequate disaster management and preparedness for disabled persons within our health facilities. And this checklist will actually be used to retrofit our facilities. We actually engaged the use of a consultant who is disabled to help us to develop a training plan to sensitize our healthcare workers as to the special needs of the disabled. Now, we recognize that there are gaps in confidentiality and objectivity in relation to having friends or relatives accompany persons who are deaf to our health facilities, and as such, we embarked on training 20 customer service representatives in the basic sign language, and we have plans to train other persons in all our health regions in sign language. And I'm listening to Ms. Goff, so we will ensure that it is the Jamaican Sign Language that is used. Plans are also in place to improve signage throughout our facilities, including special alert systems for the deaf to ensure that when they use elevators, they are alerted to when they arrive at their required floors, and also with flashing lights to ensure that designated areas used as a means of escape for emergencies are easily identified. We also plan to ensure the development of easy-to-read and more graphical presentation of educational material. In relation to screening and referral for disabilities, the Ministry of Health has been collaborating with the Early Childhood Commission on a policy and implementation plan for screening and early interventions for children with disabilities, including those with hearing disabilities. In terms of the way forward, the Ministry of Health remains committed to providing the highest quality of health care to all persons of Jamaica without discrimination or favor. And we continue to collaborate with agencies experienced in disability management on activities and plans to improve the health care of all persons with disabilities, because we do recognize that health is a fundamental human right for all persons.
The next presenter is Reverend Dr. Garnet Roper, who is no stranger to issues as it relates to persons with disabilities. And Reverend Roper will be speaking to the issue of the media and the role in communicating with persons with disabilities, in particular the deaf.
I would put the issue this way, that a few years ago, when I was pastoring in Portmore, I was confronted with the fact that there was a number of deaf people living in Portmore. And I tried to conduct an informal survey and came to the conclusion that between the deaf and the hearing impaired, there was about 5% of the population of Portmore. So it was a huge audience of persons. And I made these three observations, concluding that it is a triple disadvantaged community. One, they are silent in general. Two, their disability is invisible. Unless they indicate to you that they are disabled, it's not very easy to tell a deaf person from a hearing person. And three, they are economically and socially disempowered. And therefore, when we come to speak about the role of the media, we have to start with that acknowledgement that we are not dealing with a few people. We are dealing with a substantial subset of the Jamaican population. And we have grown up around myths and all kind of social mores that allow us to be insensitive, to discriminate against, and to treat harshly persons with disability. And I think the role of the media is of profound importance in this respect. And the first thing I think we have to commit ourselves to do in the media is to make the disabled community, including the deaf, more visible. We simply do not know how well and how wonderfully some persons who are disabled live and just the kind of strong relationships and friendship. It is an invisible population, and I think as a first importance, we must start to get to the goal where at least 1 in 20 persons that we see on the media locally is a member of the disabled community. If 10% of the population or thereabout is disabled, then some kind of affirmative action should take place so that we are aware and we normalize and we mainstream the relationship with the community. The second is basic. As a matter of right, not as a privilege, they need to be spoken to. As a minimum, caption must govern all television presentation. It takes nothing of us. In fact, it's another job. I used to love when they had the sign language on the news. And I think it's something should be a permanent feature, not for the decoration, but to respond to the rights of a neglected set of the population. And thirdly, I think that the media can lead a role in sensitizing the population. We are backward in our treatment of our brothers and sisters whose disability is more visible than their ability. We need to come into the 21st century in how the real world, you know, we were wrestling last year, and I'm glad to have been able to play some small role in getting the authorities to grant driver's license to the 3 or so persons that have so far got. We are backward. In the rest of the world, people normally drive cars, though they are deaf. Why should we require them to buy something we can't afford to buy when we have real jobs so that they can pass a driving test? And I think the media is well positioned to tell us how other people treat their disabled members of their community. And therefore that we should be far more civilized and sensitive and have a consciousness that we are denying some of the genius. I had the privilege some years ago. He put it in terms of an employment. I thought it was a friendship with Floyd. He's a very bright man. And there's not an issue going on in this country that Floyd don't know about, right? And in the same way that we neglected Sherwood content and don't put running water in the house, houses in Sherwood content, but it produced Usain Bolt. It is the same way that we are continuing to deny the nation a resource by not unleashing the genius and talent of the members of our disabled community. So the role of the media to me is simple. 1, to give visibility. 2, to ensure that there is access by simply on television ensuring that there is caption. And I concur and apologize with you because I made the point. We are not handicapped. They are not dummies. We need to get rid of that language and speak to people in a way that we like to be spoken to. And I think the media can pilot the process of helping the country to know that civilized people behave differently. So we should become far more civilized. Thank you very much.